In recent weeks, we told you about hundreds of medical debt lawsuits piling up in a Central Texas courtroom filed on behalf of one local hospital.
We haven't named the hospital because collecting money through the courts is legal. Still, we're hearing from families financially impacted, and a common complaint is they didn't pay because they couldn't get an itemized invoice to find out why they'd been charged and for what specifically.
The reason I hadn't paid the bill right away is I needed an itemized statement. I had a secondary insurance company that would reimburse me for the out-of-pocket, but they needed an itemized statement, and getting that was next to impossible.
And when they didn't pay, they got sued.
One day I came home from work and went and checked my mailbox. I had this document saying that I was being sued for $1,218 with attorney fees of $750. I didn't understand what was going on.
After our initial investigation, viewers reached out on social media, pointing us to a bill filed last legislative session in Texas to address the itemized invoice issue.
This time the chair lays out Senate Bill 2122 and recognizes Senator Hughes to explain the bill.
This bill would require a health care provider to send an itemized bill prior to attempting to collect money from the patient who had been served.
The bill passed in the Senate, but never got a hearing in the House Committee on Public Health. The bill's author, Senator Brian Hughes, wasn't available for an interview, but we did talk to one of his co-authors.
It's a very common sense theory, simple bill, which is basically send people itemized bills. And quite frankly, the only hook in it is you didn't send an itemized bill, you can't collect. So but I think people need to know what their billing is.
Will you author it this time?
If Senator Hughes doesn't want to pick it up, I'll pick it up.
The most immediate impact it will have is that patients will have assurances knowing that their credit won't be dinged unless they're made aware of exactly what they owe. And I think patients deserve that.
And while the bill received a lot of support, the Texas Hospital Association opposed it, saying hospitals are required by law to provide itemized statements if requested, but doing so with every bill would be costly.
The estimated cost of compliance for one hospital system is between $3 and $4 million without the plain language explanations built in.
The association said hospitals want to be transparent, and instead of requiring every billing statement to include an itemized invoice, it suggested including language on bills telling the patient they could request that information.
This bill is an attempt to bring transparency.
You may recall we also spoke with Representative Nicole Collier about concerns from families we interviewed, since she's previously worked to improve the state's Debt Collection Act.
Collier said she would look into whether the system adequately protects people involved in medical debt lawsuits. As she requested, we shared our data and analysis with her office and are waiting for an answer about what she plans to do next.
We'll keep you posted as we near the next legislative session in January. Until then, you can explore our complete interactive investigation on medical debt lawsuits and listen to our latest podcast featuring tips and resources if your hospital sues you. Just go to the politics section of this station's website and click on this story. When you go to vote, you'll face dozens of down-ballot decisions.
These races aren't just lines on, page 10 or 12 of their ballot, that it's something that has a real impact on their community.
Votes for school board trustees, commissioners, and county judges matter more than you might think, but it can be tough to learn about each race. Up next, how you can find what you need to know about candidates from the top of the ticket to the bottom. It's a powerful position in charge of collecting taxes and forecasting the state's multi-billion-dollar budget. We'll meet the people running for the right to manage the state's finances, their promises, and priorities for this key office.